County Commissioners Court regular meeting of January 25th, 21. It is 9:01 a.m. We are meeting in the specialty courtroom of the County Courthouse in Suite 202. If you'd stand with me for the prayer and pledge of allegiance, please. Bow your heads, please. Father, we just ask your blessing on all of our needs, the county. It's just everything, Lord. It is for Atascosa County that I pray for the people, for the business people, for the sick, for this pandemic to end, for you to get us the vaccine we need, for you, Lord, just to facilitate the solution to our problems and put your hand on us. Especially, Lord, we ask you to bless us and give us your divine guidance as we do the business of the county today, that we would do what you would have us to do. In Jesus' name, amen. Amen. Face flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We'll note for the record that we have all commissioners present. Commissioner Gillespie is present by Zoom because he's had a COVID exposure and he's following the rules and getting tested. And we hope your family's all right. We'll move forward to
yes, sir.
Public comments. I don't have any requests for public comments. Somebody that has a farm or a desire to talk in public comments that has not turned one in at this time. If there is none, we'll move on to number 4. Don Penny and Roger Garcia discuss and take appropriate action concerning an update on current COVID-19 situation, needs, and response. Good morning, gentlemen.
So the last 2 weeks we spent testing. I think we did between Jardington, Lytle, and the 5-day stand we did in Poteet, we got right around 1,400 people tested. Then that's not including what the clinics did. That's not including what our county testing site did as well. So we've been testing a lot of people. I know Leslie's been really busy. She's doing about 100 a week. So she's staying busy. We got approval from the state to do a vaccine site, 550 doses. Online sign up. A lot of people are upset. Oh, how come we didn't do it aimed at the elderly only? How come this? They got to understand it was really short notice from state to us, and we had less than 7 days to put this together. Maybe next time we can do a lot better at getting the older population in first before just opening it up to everybody. But that's how it felt. Okay. But we did fill out 550 slots. We will be doing it at the Cowboy Fellowship Tuesday, starting at 9:30 to 6:30, by appointment only. If you miss your appointment, they're going to give you, I think, about an hour roughly to make your appointment time. If you can't make it, they're going to move on to the next person. But we've got it arranged with EMS, the Sheriff's Office. We've got text assistance in this. TDH is helping out, and the fellowship is provided the facility. So we'll see tomorrow morning how well it goes.
Anything else?
I have a question.
Yes, sir.
The current COVID statistics, I saw a comment this weekend. We're recording 18 deaths. Is that still what we're recording?
No. It is what they're reporting, yes.
Yeah, it's what they're recording.
But
still.
we don't,
but they haven't changed at all. I don't know why.
The TDISH dashboard has showing 80.
Okay. So
90?
This is from state. Basically what he says in the text message, the short versions, we aren't receiving the info we need from the providers to investigate the deaths.
Okay.
So on their end, they're not getting adequate information, so they're not pushing out improper information to us.
So, but they're listing 80 or 90. Is that what you're saying?
Yeah, they're not sharing what they're seeing because they don't want to give us something to have to fight back and argue with them again. They're just trying not to mislead with misinformation.
Okay.
In our view, and 3 of us, that's not even close to accurate.
Yeah.
And I've helped intervene and make arrangements for the funeral homes in Atascosa County to find extra storage, if that'll tell you that these numbers are not correct. Essentially, it's not that It's not 18. We don't know whether it's 18 or 90, but it's hadn't changed in weeks, and we know that's not correct.
Yeah.
So we know there's something wrong with that number. And,
So I'm gonna presume that we're actively pursuing this information from the state, is that accurate?
Yeah, I mean, Don's got a direct message from the only person that we deal with, and until they get it.
The reason I bring it up is I've heard some things and comments that, you know, we're just not reporting factual information. It's remained the same for months.
Yeah.
well, that may be true, but we're reporting the information we get from the state.
No argument there.
There is a lot of there's a lot of problems with the numbers, and between the probables, the pending, and the active. All we know is, if you look at the total, the probables and the pending have shot up, as well as the confirmed. So we know that it's high, and we know that it's bad, and we know that the hospitals are busy. But as to tell you that anybody's got a good handle on the number, Commissioner, I would have to tell you it's my personal view, they don't.
Okay.
And we ask for it all the time. We ask for clarification. And I don't know that I want to throw any stones at the state officials. I think they're struggling to do the best they can with what they got, and it's a difficult situation. But we do need better numbers. I don't argue with that at all. I wanted to make a statement that a little bit contrary to something you said, Roger, and that's that through my office, we ask, what happened to us for the public's information is that I got a call from Region 8, which is Region 8 of Texas Department of State Health Services, which we call TDISH because it's easier. And they offered us a 550-shot clinic. And it was strictly for 1A and 1B personnel. And 1A is active health professionals, and 1B is 65 and older or people with underlying health conditions. We ask in my office to carve out 150 for us because we've been saving lists from people, and they're all seniors, who are upset that they can't get anywhere. It's frustrating. They have a real problem booking. They could go to San Antonio, but even booking that online is frustrating for many people. So Robbie's done a great job of keeping a list of these people. So they were up on top. So we were able to get 150 that we had control of. And I can tell you that we vetted every one of them.
No, I was talking
so
about.
they are either, I don't think there's any health professionals, there might be, that missed it, but these are all over 65 and are underlying health conditions.
Yeah, I was addressing the people on Facebook who said we didn't handle it very well. I think we handled it very well, in my opinion.
I think we did too. I think we were very diligent about it. We were very fair, and we continued to. What happened was we had the list we had, and then we started calling county officials, judges, people we knew that were over 65 to see if they wanted to take it, sticking to the rules, and then that rippled out. They would have some friend that was over 65, or actually I had people calling me, and so when we called these people and told them we had a slot for them, then we might get a call from 2 or 3 of their friends, and this thing went fast.
Yeah. No, yeah.
It really was word of mouth.
Yeah,
and
the
it
online
went fast, but we tried to advertise it on emergency management page, and we tried to be diligent about it. But
yeah.
They told us when they gave it to us that they just had one in Goliad, and it booked in an hour and 15 minutes.
Ours closed out the online portion in less than 20 minutes.
20 minutes?
Yes, sir. Less than 20 minutes.
So, but we did something a little different, and that was we asked for the county to be able to have some control over some of these so we could take care of some of these people who have expressed complaints, who do meet the qualifications,
Yes.
and who deserve some consideration, and we've been over backwards to do that.
Yeah. When I looked at the second to final list, I got the final list coming in today. But when we pushed that out on social media, we got calls from a bunch of the news agencies wanting to run reports on it, like in minutes, Telemundo 12:29. So when they pushed that out, we got half of our online list was actually, I got people from Seguin, Lavernia, Cotulla, Laredo. We got people coming from all over the area. They're not just Atascosa County, so having that side list was beneficial to our people.
And just for public information, because I've written about it in my column, I may be tilting at windmills. I don't know if you know what I mean by that, but it might be a little bit hopeful. But there's nothing wrong with being hopeful. I've always been a little hopeful, and if I fall short, we fall short. But I've had this idea of trying to put together a regional vaccination program, and some people misunderstood it. They don't want to know why we're not doing it now. Well, the reason is the vaccine's not there. But I'm seeking to have a regional drive-through vaccination program with a goal of 10,000 shots. We just have to source the vaccine. I've talked to Senator Zaffarini and Representative Guillen, and of course they just kind of throw their hands up. They say, well, you know, we can only do what the state can do. Well, I've made a move to try to, I will not bypass the state. We will tell them what we're doing. But I've had several long talks with COVID pay, COVID compensation, and vaccine with Congressman Cuellar. So I sent, this is not meant to be humorous, but I hope you can see some humor in it. I drew up a plan. I've talked to the Strawberry Festival Association. They're willing to give us their property, no charge, for as long as we want it. If they're not sure if they're going to have Strawberry Festival, but when they need to get ready for Strawberry Festival, they may need to take it back temporarily. But we can have it for February and March for sure. And I sent a long, detailed plan with a map of the festival and how it would work to Congressman Cuellar's office. And I told him, I said, well, Congressman Cuellar, you're head of the Appropriations Committee in the House. That's a pretty powerful job. And you now, your party now has the Senate and the White House, so how about getting me some help? And his staff has a Zoom meeting with me tomorrow morning at 8 o'clock, so at least I'm encouraged that they're talking to me. So I'm going to keep pushing on that. I may not get anywhere with it, and it may be a little bit hopeful, but this problem's all over the state. On judges' listserv, I'm on judges' listserv, which is like a blog among judges. The commissioners have one, and treasurers have one, and auditors have one, and it's all over the state. Judges, their counties in West Texas has never been allocated any vaccine. They've got to go, like some of those little counties in West Texas, they have to go to Lubbock or Amarillo or Odessa and tag on to theirs. It's a problem statewide. There's just not enough vaccine. And the way it's being allocated out is not under TDISH. It's under a committee that the governor built with the key officials of his COVID committee, and they're determining who gets what. And I'm not even criticizing them. They don't have enough. They don't have enough vaccine. It's problematic, and we're just keep pushing as hard as we can to get everything we can. I think you were in my office when I talked to Colin, and he said we want to do a 550 shot clinic, and do you want to have it? And I said absolutely. When do you want to have it? And he said, gave us a date, and I said that's fine. He said, can you have an EMS ambulance there? Absolutely. Can you have security? Absolutely. We'll do anything you want. We want the shots for Atascosa County. And so we will get 550 done. Then they will come back in 28 days just for public information with the second shot for the same people that got the first shot.
Yeah, they're going to come back, and those same people will have the same scheduled time that they had today.
But we're doing everything we can to make the state officials and the people running these programs feel warm and comfortable when they come to Atascosa County. We want them to feel like when they have vaccine to administer and they need some place to do it, that they've got an open door here. We've done the same thing for them on testing. And I want to comment again, like I did last meeting on testing, that some people have posted, and a lot of people post some interesting things on our emergency management Facebook page, but some people posted that we were testing just to pump up the numbers. But nothing could be further from the truth. If somebody's got COVID, I don't know why we wouldn't want to know it. But the real reason I asked for it, and the real reason Roger put it together, and I'm so appreciative of the work that he's done, is that people called me and said, I can't get a test. I don't have insurance, and it's $200 at the clinic. So we did this for the people that don't have the money to pay for COVID testing, that feel they need it, not to pump up the numbers. And I appreciate you taking care of it. Anything else?
No, answer no
Okay.
questions.
Thank you very much.
Thank you.
Moving on to agenda item number 5, Don Penny, discuss and take appropriate action concerning personnel, existing employee Brandy Fournier, position full-time EMT basic, pay rate $11.70 per hour, $17.55 overtime plus $120 uniform allowance monthly. Waive the wait time on benefits and insurance. And why are you waiving the wait time?
She's been with
She's
me.
been part-time?
She's been part-time with me for a long,
Just wanted to put that in the record.
yes.
And salary budget area 041-400-430, regular 404 for overtime. Physical drug test is pending. Start date is 02/01/2021. Mr. Penny.
Her physical and drug is completed, paperwork has been turned in. And like you mentioned, I wanted to waive the insurance and everything. She's been part-time with me for a while. She is one that, if I need her, she will come in. With our COVID and everything, she's always been there for me. But yeah, I'd just like to move her from the existing part-time into a full-time employee status. I did have one employee turn in his resignation. He's moving on to nursing school. So he's gonna move on with his life, and I need to fill that spot.
So,
Motion by Commissioner Perez, second by Commissioner Riley. Discussion. All those in favor, please indicate by raising your right hand. Motion carries. Thank you, sir. Number 6, Don Penny, discuss and take appropriate action concerning giving part-time EMS workers increase from $10 per hour to $12 per hour. Mr. Penny.
This here, right now, my part-time employees are currently at $10 an hour. From what I've gathered, the rest of the county employees are at 12. That's not the biggest part. The biggest part is I can't get people to come in and work for $10 an hour. I got paramedics. If I need a spot, people don't want to come from San Antonio down here to fill in a 24-hour period for $10 an hour. It's not much, but it's limited. Yes, they're going to be right around my full-time employees' pay rate. However, they can't have as many hours per week and month. My full-time employees, they get 96 hours a week or 72. My part-time employees, I'm limited to 29 hours a week on them. So, and of course, they don't get the benefits and everything else that a full-time employee gets.
Motion by Commissioner Knowlton for approval. Second by Commissioner Perez. Yeah, I think, and you're not going higher than 12 because that's kind of our top part-time rate in the county, and that's why you're taking it to that number. I think we thought, and I have thought, that these part-time people made overtime. That's why our rate seems low on the person we just added at 1171, but you can note that the overtime rate on that person is
$17.55.
1755.
Part-timers do make overtime if they work 2 days. They do
Yes.
make overtime, and they do get it at time and a half.
Yes.
It's to set the record straight, so they don't make overtime. If they fill in a shift for somebody that's a 2-day shift, that's 48 hours, so there's 40 hours of regular and 8 hours of overtime.
Okay.
But if I do, and she can fall back on my stuff, I try to limit them at 29 hours a week. There are times that, you know, I have to go over because I got people out on COVID and everything. And I get it, I understand it. Even if they do the $10 an hour, they still make $15 an hour overtime. But I try to limit them at 29 hours a week. If I can successfully do it. If I don't have people to fill that spot, of course I need somebody to do it, either that or I have to get on the truck, and I've been on the truck quite a few times because of COVID and everything.
Yes, ma'am.
Just wanted to make a note that, just be aware that that'll be in the budget.
Yes, yes. And I usually have overtime salary left out of my budget. I usually have a pretty good portion of overtime budget left that we usually take to fill in another spot, you know, to move money towards the end of the year. And I've been within budget my years that I've been here.
Just take that, but yes, his budget usually stays under.
There's no budget change. He has adequate money in his part-time budget to cover this. We've discussed this.
I'm usually taking money out of my part-time budget to fill in another spot.
But we discussed him keeping an eye on the overtime part of it. And Ms. Pavlik's exactly right. If they run 2 days, then they get 48 hours pay.
You know, everything the board has needed, we were not gonna give any raises, this is a raise, even if it's a part-timer, it's a raise. And I can guarantee you all are gonna have some feedback from that, just make sure, you understand.
I have a question, to her comment, that you have people that you're gonna raise up to the level on board now?
Just part-time people, just to get them to come and work here.
No, I'm saying people on your part-time staff right now, are you gonna give them a raise?
They will, if it takes effect, yes. But right now, I only have like 4 or 5 people on my part-time list, because I can't get people to
So
work.
how many do you think you're gonna be bringing up?
4 or 5.
But Mr. Billy's point is valid. We are, as I understand it, we've been under a raise freeze, hiring freeze for several months, or at least 2 months anyway. And this would be outside of that policy, would it not?
Explain again how short you are with hiring people and covering runs.
Well, and let me continue before he answers.
Yeah.
You do have the right to justify your request, and that's what's really going on here.
Okay?
Yeah, that's,
I get it, understand.
And I will speak up for it, that I understand that. But I just want everybody to be aware, of the situation, and yes, he does have a hard time, and our EMS are the, first line of defense. I understand, I just wanna make sure that everybody knows what, the consequences, you know, is.
But in following the rules, yes, you know, if we're gonna give a raise to somebody, you gotta completely justify it in court. We set up in the beginning.
Okay, I got 16 employees right now that are full-time employees. If 2 of them go out on COVID, I have to fill those slots with part-time employees. If not, I don't have a unit available for that area, which cuts me down to 3 units in the county.
it means you take an ambulance offline.
I'm taking an ambulance offline, and I do not want to do that. I've had to do it once or twice. I've, again, volunteered to come in and work on ambulance, but I couldn't get nobody else to work with me on ambulance. Right now, our call volume is 5,500 a year. That's between 4 ambulances. A lot of that we're doing Divine in the Medina area, because for mutual aid, we are doing a lot of their calls over there lately. My Lidl truck, because it's in there, they send them to Natalia and Divine. That's actually taking a unit out of my area, but I'm still paying them personnel for that time. But if I can't get nobody to work, and it really just hurts the public, because if I don't have an ambulance ready for them, I mean, I'll go in my truck and I have equipment in my truck, I can first respond, but I'm limited to what I can do. And, you know, I've even considered putting a 5th unit on during this COVID stuff, which, you know, because of our call volume, from 2011, we're at 2,000 something calls. Now, here we are at 5,000 something calls without an increase. 2014 is when we were fully staffed with 4 ambulances.
It brings up another question. You mentioned Medina County, we're sending people there.
Because we have a mutual aid agreement that
Okay.
if Medina County units are, and they come over in the Lidl.
That was my question. Do
Yes,
they
they come over in the
reciprocate?
line.
Yes.
Yes, it's a mutual aid. We work together
Okay.
pretty good on that. But yesterday, we went to Medina County 3 times yesterday, I believe. And it's over there on the weekends that they don't have an ambulance late at night or whatever.
Okay.
It's not like we're leaving us uncovered, but, you know, we assist them. And they assist us back.
All right. That was really my question. Do they reciprocate? Yes.
There was a point last night that dispatchers and me were on the phone 11 different times together within a 2-hour period, trying to find ambulances to cover areas. Acadian wasn't available, Lone Star wasn't available, Sherman wasn't available. We were gonna send my Jordanton unit to Lidl to take care of a patient. But my Lidl truck was able to clear out of the hospital in San Antonio and get back in district fast enough to get that truck, or to get that patient.
Okay.
My biggest thing is, my call volume has gone up so greatly, and with COVID, if I got 2 people out, it's hard to fill the spots. And I'm sure y'all would agree that, you know, EMS is an important part right now in the community. And if I don't have the trucks and the people, it's the community that suffers. It's not me, it's the community.
And to answer your question, as far as part-time, if you're changing the rate for the part-time, anybody he picks up, you know, from this point forward is just gonna get the new rate. Those individuals that are working for him as part-time, it's not a permanent position, is it? Are
No.
they permanent? They're all basically, they come and go.
They
Okay.
come and
So
go.
changing a rate to be able to get more people in, and it's justifiable to the court,
Certainly.
then, I don't see an issue with that as long as he stays within the budget, which he's aware of, so.
And we are actually on the low end of part-time pay. Atascosa County is. You can go over to Wilson, Carnes, and all them. They're looking at $18, $19 part-time pay for their techs. So we are on the extreme low end.
For the ambulances?
Yes, and they get people to work for them. I call people and, you know, hey, I need a spot. Well, what's your rate? $10. No, I ain't coming over there for $10. And I know $12 isn't a significant jump. It is budget-wise, but it may be, well, maybe I'll come over and, you know, help you out.
But even doing this, he's currently, we would still be within his budget, is that correct? Okay, so you
And
answered my
I know
question.
it's your policy, you know, no raises or anything, but, you know, I feel that if I want people to get down here and work, you know, I need a little bit of incentive for them to come down and work.
Okay.
How do you cover for vacations?
Same way, part-time people?
Part-time people, so
Or myself, or-
you only have enough full-time people to make your shifts.
No, a lot of my full-time people, they'll come over and cover them, but, you know, not everybody will. You know, I got certain people that know they won't work no extra time
But you're
whatsoever.
talking about off-duty, you're talking about
Right.
off-duty full-time.
Off-duty people, off-duty
They were
full-time.
making full-time and a half at doing that, which is,
That's really expensive, because that gets up to, you know, if it's a paramedic, you're looking at, what, $19 an hour for them on overtime? And usually my overtime,
you know,
my full-time overtime budget is usually where I have to move money into by the end of the year.
so it's cheaper for you to bring the part-time people in.
Yes.
If we keep them out of the overtime level, I agree, it's a tough situation, but it's an emergency service, so it's up to the commissioners.
It's essential. We have a motion in a second, I
We
believe.
do have a motion and a second.
Your Honor, if I may,
Yes, sir? Commissioner Gillespie?
do you have can you hear me okay?
Yes,
Can you hear me?
yes.
Yes.
Can you hear me okay?
Yes.
Okay, if I can, we're only having a discussion because we're in it. And obviously, if we weren't in a, criteria that we're in with the coronavirus, this would have passed already. We would have already been on that next agenda item. I see the reasoning of the discussion. However, if we all remember back in our workshop that we had while discussing budgets and part-time, the EMS and the sheriff's departments were considered essential workers when it come to all their employees as needed. And I'm personally for the raise because I do see the shorthand of it. I hear people talk of it all the time. I talk with Don quite a bit. I do see it. I don't think $2 an hour is going to make or break it when you only have 4 people. I think it's a good move because of their essential position in the county. As far as, I think in all the road crews did away with their part-time workers. So it's not like we're still hiring part-time, but for EMS and Sheriff's Department. I'm just speaking my mind. I just wanted to bring that up so it's thought about. You can carry on my end.
Thank you. Are we ready?
Yeah, I'll
to take
call
a
the
vote?
question.
Okay. All those in favor of the motion, please indicate by raising your right hand. Motion carries. Thank you very much.
Thank you,
We
gentlemen.
may want to, when we get into budget time for next year, we may want to take a longer and harder look at this and look at the pay scales of the
I have a,
EMS units that are, the EMS units that he's referring to, and I'm sure the commissioners know this, but for public information, is these are the ESDs, the extra, I'm sorry, the services, emergency services districts, ESDs.
yes,
Are the only, we're unique in that the ambulance system is under the county. In Wilson County and Medina County, and of course all of Bear County, which is a totally different category, is all ESD services.
Correct.
But it's still, we're still competing with them for employees, and we are an essential service. If people want, I know if I have an emergency at home, I want to call 911, I want an EMS unit to roll up.
That begs another question for me, and we can't do anything about it right
Yes, sir.
now,
Go
but
ahead.
we have a Lytle ISD coming up, correct?
ESD,
a Lytle
yes.
ESD, yes.
Does that
But they
relieve?
do not want nothing to do with the ambulance. All they want is fire ESD.
Okay, so they just want fire. Okay, that answered my question.
And I have, this talk with the Lytle ESD's been going on for a couple of years, and each time I brought up to them that we'd be happy to have you take over the northwest quadrant of the county with ambulance service, and the only thing to do with it.
I get the headache.
I say we'd be happy, we would be amenable to it, we get along with it. I think we have an outstanding EMS system, and one that we can be proud of, that I would compare against any other county our size anywhere. And but we do have to compete with these others for pay, was my point. And you brought that up, so I think we ought to do a full rate payroll survey when we get into budget this summer, and work on that. Thank you, we're done. Thank you very much.
Thank you, gentlemen.
Sorry we grilled you so hard.
You can blame Miss Pavelli. Need a Band-Aid? Need a Band-Aid?
Agenda item 7, discuss and take appropriate action concerning approval of a final plat for the Guadalupe Donato subdivision, a 5-lot subdivision located off of FM Road 476 in Precinct 1, Atascosa County. Plat is approved by the County Attorney's Office. Mr. Rowell, good morning.
Good morning. This is a non-construction plan, blank subdivision, five lots, which will be serviced by McCoy water system. They have complied with everything. They've got their will serve letters from McCoy, from Carnes Electric. Our septic department has been out there. Mr. Newman has inspected and said that it's ready to go whenever they are ready to sell these lots. So they paid their $400, and I delivered that to Ms. Favelic today, and so we're requesting that it be approved.
I don't have anything in my packet on plan.
I may have present this to the court. Like I said, it doesn't have
do.
any construction plans. It's just a straight up division of land.
Is something we can look at real quick?
Yeah. I got a big one, but here it is. And it's all, it has Anderson and off of 476, so no shared road.
And just a question, would they, if this is off FM 476, do they request the right of access from state?
We did, yes,
And
sir.
that's in their packet. They've,
So
Got
what
it.
you'll see, Mr. Knowlton, on there as well is, there's 5 lots. Ms. Donato wants to divide that 5 acres into 1 acre lots to convey to family. We talked to TxDOT, and they're gonna give 3 access points. So
Okay.
not every lot will have their own driveway, so 2 of those will be shared access driveways, and then the middle one will be
All right.
a single drive. So we've coordinated with the state, and we do have approval from the state as far as location. Now, when they go to pull their driveway, they'll have to go get their permit to do it, but we do have
Correct.
location approval.
Okay.
You have one lot here that doesn't have an entrance.
It does.
It'll be through a shared access.
There's
If you
2
look,
shared
Judge Hurley,
access.
there's an easement there, that's a shared access easement. So they'll share a driveway basically for those lots.
The 2 on the end share, on either end share access. The one in the center has its own access, the 2 on either end.
Yeah, one on the side.
What are you talking about, lot 4 on this map?
Yeah, it's okay. It's just, I look at the size, and the size is bigger for the shared one, but the graphic is smaller than that one, so it makes that one look tinier than that one.
Right, so that's an existing driveway.
And this is a shared one here too.
That's a shared and that's an existing.
Right, okay.
What we've noticed is it can go up to 30-foot maximum, and then they have shared access across here, so they can
Okay.
continue a driveway into that lot.
This belongs to-
But that would be up to the state.
Yeah, yeah, it's not us.
Nothing to do with this.
You know, we're not approving the driveways, we're just approving the plan.
You're making sure they have access, so yes, sir.
Okay? Any questions, Commissioner Gillespie?
I reached out to Francis with TxDOT last week on those driveway issues, and she said they're doing like a variance on them because they're under 400 feet apart, but the amount of traffic that's going to be coming in and out of each of one of those entrances on 476, that being it was residents, it wasn't going to be an issue for them to do a combination driveway. They were fine with it. TxDOT's passing it through already on their end with the driveway. So really, that's on them. The plats are on us, and I move for approval.
Second.
Motion by Commissioner Gillespie, second by Commissioner Knowlton. Discussion? All those in favor, please indicate by raising your right hand. Motion carries. Thank you very much.
And I have to run, and I've already signed, the plats are here, so all of you that are here, and Mr. Gillespie, all of you that are here, please don't leave without signing that.
Okay?
Yeah, we'll stick around to the end.
And
I need to talk to you later.
yes, I will get with you today. I got your email. All right, thank you.
Okay. Number 8, Linda Burris and Lee Ricks discuss and take appropriate action concerning renewing property and casualty insurance for 2021 through Ricks Insurance. Good morning. Good morning. That's a lot of paper. It is.
Oh, you did, you.
While Lee's passing out the proposals for the property and casualty insurance for the 2021 renewal, I wanted to let you know that we have met with the judge and Commissioner Knowlton and gone over some of mostly the property schedule. And we did make some large increases in the limits on some of the buildings, over $3 million in total increased limits for coverage on the buildings. The majority of that increase was on this building, the courthouse building, because we had not increased that limit in some time. There were also, between this time last year and now, we've had an additional 18 vehicles. So with the increase in the property limits and the increase in the vehicles, the premium is up. We've also had pressure, industry-wide, pressure on auto rates and property rates has resulted in increases in those rates statewide, not just for the county because of claims, but statewide, industry-wide because of claims in those areas. As we've done before, we bumped up the automatic coverage years on the larger vehicles from 2009 and newer. Now it's going to be 2010 and newer will have automatic physical damage coverage. And on other vehicles other than emergency vehicles, 2012 year models will have, and newer will have automatic physical damage coverage. Emergency vehicles, all, regardless of the age, will have automatic physical damage coverage.
I've closed the full proposal from Travelers, so you have all the details, as well as that volunteer accident policy renewal coverage. And if you go to page 59, that is a recap of the comparison of premiums from last year to this year. Other than the property and the auto, the majority of the other lines of business, the law liability, the general liability, the public entity liability, the employer's practice liability, those rates had either little to no increase. You'll see the limits on the last 2 pages of the proposal are the property limits that we're proposing for the renewal.
Yeah, you have the ones that have been changed in bold, right?
Yes, sir.
Yeah, that's very good work. So commissioners need to look at the ones that have been changed. It shows their we raised the courthouse from coverage of about 5 million to 8 million, which certainly wouldn't rebuild another courthouse, but 5 million was, my comment was, commissioners, was that it's most likely what would happen here is that there would, if there was a fire or a windstorm or act of God damage, it would not destroy the building would have to be repaired. And we need to make sure we have enough coverage to rebuild that. And but $8 million would not touch rebuilding this building. And but $5 million was, it just hadn't been changed in years. So we tried to be cautious and conservative and not raise it too much. So it's up $40,000 from $560,000 for the record and for the public that's listening. And with all the things we had to adjust and make sure we have adequate coverage for this property, the Atascosa County citizens, so that we protect it. And I think Rick's has done a really good job with Travelers. And,
We have had a good relationship with Travelers. They've been very responsive and
never had a problem with the claim either. Of course, Linda, they had to fight with Linda. I like having Linda. It's like she works for us. I like that lady.
thank you. Any other questions or any questions?
Well, we're ready for a motion to approve the insurance. I'm sorry you can't see this, Commissioner Gillespie. We'll save your copies for you.
So moved.
Thank you.
So moved.
Motion by Commissioner Perez, second by Commissioner Riley. Any discussion? All those in favor, please indicate by raising your right hand. Motion carries. Thank you very much.
Thank you very
We
much.
appreciate what Rick's Insurance does for us.
Take care.
Very welcome.
Number 9, Drew Benavides, County Agent's Annual Interpretation presented by Atascosa County, Texas A&M AgriLife Extension Staff. Are you going to do poetry interpretation or?
We just wanted, basically, we're here, we have some reports for you.
I'm sorry, I was just making a joke.
We basically want to come and say thank you for y'all's support.
Thanks.
It goes without saying, this year is turned upside down, and we've learned how to do things much different.
Thank you.
And we want to thank Justin, because, you know, he gets our calls about how we're doing things different. And so your workload has gone up, so thank you very much. But basically, we just want to be here on behalf of the office with Ashley Statement, Monica Decatur too, to say thank y'all for all y'all's support. This has been a heck of a year, but we got through it, and with y'all's support, we just really appreciate it.
That's just a snapshot of some of our bigger programs, bigger educational events that we did in 2020, and then that top cover, just a snapshot of some of the activities and events that are scheduled already tentatively for 2021. So.
Even our fingers crossed.
Well, I know you've had a tough year. Really, everybody has. And without going back to the COVID thing, I'm totally convinced the only solution is going to be vaccination. And the boosters, and I think we're gonna be in a booster situation with it until they know how long it lasts. They don't know how long it lasts. And we've had some employees, I know the sheriff's had too, I think, that have re-caught it a second time. And that's scary. And so the only solution is gonna be vaccination, and then we'll have to let medical experts tell us how often boosters are gonna have to be taken. But I think we're gonna be in that mode for a couple of years. That's the only thing that's gonna get this under control. I appreciate your work and how hard of a time you've had. I know you've tried, you've done a lot of webinars, you folks have really, in your offices, A&M program has done a great job. I appreciate it. Thank you very much.
Thank you.
Number 10, Justin Vasquez, discuss and take appropriate action regarding enrolling county employees into the 2021 annual cybersecurity compliance training course provided by Texas Association of Counties to be completed by June 15th, 2021. Good morning.
Morning. This is just an every year thing according to House Bill 3834 that passed in 2019, I believe, where every county employee who uses a computer for at least 25% of their job needs to take a cybersecurity compliance training course, and the completion date is June 15th, 2021.
I thought most everybody had done this, or you just...
Have to do it every year.
Oh, wait, we have to do it
every
again?
year.
Well, thank you. Thank the state.
Don't thank me.
You can't fix it.
I can't fix it.
Are you going to send us a link, or what's our...
So the first
gonna
step
do?
is enrolling all the county employees, getting accounts set up, and then the link will be sent out to actually take the course.
So you need us to approve that? Is there an expense to this?
It's Texas Association of Counties is providing it for free,
You just do it
Whatever it
online.
is. That's good.
and we like their course, so that's it.
So move.
Motion by Commissioner Gillespie, second by Commissioner Knowlton. Discussion. All those in favor, please indicate by raising your right hand. Motion carries.
Thank you.
Thank you. Number 11, Sheriff Soward. Morning, Sheriff. Would you like to take these one at a time?
Roll them all together, Judge.
All together. New employee, Maria Maldonado, position corrections officer, pay rate 41750, 11, tier 2, 171 fluctuating pay plan, 90-day county probation, 1-year agency probation, $150 holiday pay, $120 uniform, salary budget area 012442562. Physical drug test is complete. Start date is 01/25/2021. And the second one is Matthew Xavier Chalaria, and all of his data is the same as what I just read for Maldonado. And the third one is Nicole Ann Gomez, and all of her information is exactly the same as Ms. Maldonado's. Sure.
Yes, sir. These are 3 new correction officers, all essential positions to replace vacancies we have for various reasons.
Move approval.
Motion by Commissioner Knowlton,
Second.
second by Commissioner Perez. Discussion. All those in favor, please indicate by raising your right hand. Motion carries. Thank you.
Thank you.
Thank you, Sheriff. Number 12, Commissioner Alessio Perez, discuss and take appropriate action concerning personnel. New employee Larry Balaam May, position road crew precinct 3, 35,648. Annually, salary budget area 023-400-402. Physical drug test is complete. Start date is 02/01/2021. And we have a second person, Martin Castillo Jr., and his information is identical to Larry Mays. And we have a third one, Justin Kidd, and his information is identical to Mr. May. Commissioner Perez.
Thank you, Judge. These 3 employees are new employees to fill in out of the 4 vacancies that I had. I'd like to get approval, and I'm going to take the approval. I'll second.
Motion by Commissioner Perez, second by Commissioner Knowlton.
I have one more comment. You still have one opening that you're keeping open?
Yeah.
Okay.
You beat me to it. I was going to say thank you for keeping that vacancy that you committed to. Appreciate it. So,
Yeah,
we have a
motion.
motion and a second. Any other discussion or questions? All those in favor, please indicate by raising your right hand. Motion carries. Commissioner Riley, discuss and take appropriate action concerning issuing McCoy Water Supply Corporation a permit for a road bore located in Precinct 4 at 89 Trails End Drive, Pleasanton, for Alvin Melendez. Commissioner Riley.
Yes, this is just a road bore out there on what we call the trails. It'll be the south side of 97, back to that subdivision, which I've looked at. Everything's to approval.
Motion by Commissioner Riley, second by Commissioner Walton. Discussion or questions? There's no check to tender because we don't charge McCoy water.
Yes, sir.
They give us water and we trade things out. So we're not giving them anything, we're bartering. So all those in favor, please indicate by raising your right hand. Motion carries. Thank you. Number 14, Tracy Barrera, discuss and take appropriate action on approving the annual software renewal 0305-2021 to 0304-2022 from ESRI, quote number 2599432 in the amount of $1,511.25 from line item license fee, line number 012472-639 for the Atascosa County Rural Addressing Department. See attached. Ms. Barrera.
This is our annual renewal. The price has not changed. It's the same as it was before.
And this is what the Rural Addressing Department uses.
Move for approval.
Motion by Commissioner Riley,
Second.
second by Commissioner Knowlton. Discussion, questions? All those in favor, please indicate by raising your right hand. Motion carries. Thank you. Number 15, Judge Hurley, discuss and take appropriate action concerning lease contract with St. Matthew's Catholic Church for antenna. We're not ready to take this contract up today. We're waiting for a proposed contract from St. Matthew's, but I'd like to go ahead and explain it to you so you know what's going on. Several years ago, we were, and Sheriff, you can correct me if I get anything wrong, please. We were startled, would that be a good word, to find out that our number one, first and original, and probably our major communication antenna owned by the county is not on property owned by the county. It's owned by St. Matthew's. So we did a lot of research on it. What triggered it into it, we were looking for a place to put Atascosa Animal Control, and it turns out, that's how we found out about this. It turns out that, St. Matthew's objected because it was too close to their cemetery, and you know, we went over 4 or 5 different places before we settled on where we are, kind of where no one could complain about its location. Because people objected to noise, or they seem to think it was going to smell bad. If you go out to our animal control facility, you'll find out it's spotless, most days. But a lot of that's thanks to the sheriff's help with the trustees that go out there and clean. But at any rate, as we researched this land, we found out it truly was owned by St. Matthew's. So we thought we had a solution, and they offered. I mean, and again, Sheriff, you can tell me if I get this wrong, but the business committee of the church was very amenable to the idea of selling us just a portion of the land that we needed to keep our antenna on. But the archdiocese has a policy of not selling property. Is that about right? And I don't think, in general, they have a policy of not selling property. They don't want to if they don't like to do that. I have to confess that I stopped paying attention and quit thinking about it, and I thought we had worked out a contract, and then the sheriff pointed out the other day, we never did. Well, interestingly enough, the tax appraisal district decided that this particular 5 acres, and I think there's some other land too, which isn't our concern, was put on the tax rolls, and they started charging the diocese property taxes on it, and they're not real happy about it.
They have been in for 40 plus years now.
Yeah, Yeah, we deeded that, I pulled the deeds on this when all this came up, and the deeds are that the county deeded the property to them. I don't, you know, Commissioner Court records are probably long gone. Who knows what happened? They may have done it on a handshake, or we'll give you this land, let us put our antenna on it. And, you know, those days are gone when that happens. Now we're thinking you got to have a contract on it. And back in the old days, they could shake hands on stuff. And who knows what happened? But I'm sure that everybody did the right thing with it, the county and St. Matthews. But we're in we have an opportunity to address this now, and we're going to bring Commissioners Court a contract for us for, I don't know whether it's 30, 40, or 50 years, but a long-term lease to utilize that property for about $2,400 a year, which is a minimal cost. And it's going to cover their taxes, plus a little bit for increase in taxes over future years. And the only alternative we have is to buy new land and pay $250,000 to put up a new antenna. And so $2,400 a year sounds like a pretty reasonable solution, and it covers their taxes. So we'll be bringing you a contract for that. Commissioners, if you have any questions on it, I'll be happy to answer them now. It's in public forum, or thoughts.
No action.
No action. We don't have the contract, so we can't act on it. We don't know how long it is. We'll see. And we haven't run it by the county attorney's office yet. But I just went ahead and erred on the side of caution and put it on the agenda so I could at least explain to Commissioners Court that something was going on with it. Any questions? If not, we'll move on to agenda item number 16. Discuss and take appropriate action concerning the following budget line item adjustments or budget amendments to the following. See attached. Constable Precinct 1, moving funds from 012412493, Social Security 3 cents to 012412401 for the same amount. Constable Precinct 2, moving funds from 012414493, Social Security for 2 cents to 012414491 to retirement for the same amount. County Judge moving funds from 012424610 conference for $344.50 to retirement $24.50. That's 012424491 and 012424710 annual longevity of $320. Justice Peace Precinct 1 moving funds from 012426610 conference for $600 to 012426501 office supplies for $600. Justice of Peace Precinct 3 and 4, 012430406 magistration allowance $750. 012430491 retirement $5729. 012430493 Social Security $5741. 012432406 magistration allowance $750. 012432491 retirement $5729. 012432493 Social Security $5741. Fire Marshal moving funds from 012445610 conference $600 to 012445509 emergency supplies for $600. Emergency management moving funds from 012447610 conference $16.45 to 012447429 salary floodplain manager $1645. These should be all year-end adjustments. Is this final cleanup?
Yes, for the most part. There are some more,
But we pretty much have to do it this month, right?
Yes.
Yeah. This is for the budget for last year.
Yes, this is all 2020.
Did I read district judges?
No.
District judges, moving funds from 012468665 miscellaneous $1,500 to 012454687 insurance professional liability $1,500. Anyone care to make a motion to approve all these changes?
So moved.
Motion by Commissioner Perez, second by Commissioner Knowlton. Any discussion or questions? All those in favor, please indicate by raising your right hand. Motion carries. We've lost Commissioner Gillespie. Discuss, review, and take action to accept and approve any invoices and payroll. So we have no live checks, is that right? So we're approving the bills that have already been signed by the commissioners and myself. There's a payroll.
Second.
Motion by Commissioner Knowlton, second by Commissioner Riley. Discussion. All those in favor, please indicate by raising your right hand. Motion carries. Thank you. Discuss and take action on reports. This is the second meeting of the month. We do not have any reports to review at this meeting. It's at the first meeting. Number 19, update and take appropriate action concerning judge, commissioners, and other county elected officials training course certifications recording the hours and certificates in the Commissioners Court minutes and other documents not related to education needing to be filed in the court records. So we have a certificate to approve from Margaret Littleton. Completion from County and District Clerks Association of Texas awarded to Margaret Littleton for completing the required 20 hours of continuing education for 2020 as prescribed in Section 51.605 of the Texas Government Code. Need a motion to approve. Motion by Commissioner Wilson.
Second.
Second by Commissioner Perez. Discussion. All those in favor, please indicate by raising your right hand. Motion carries. And then number 20 is comments from Commissioners Court. No action to be taken, nor can we discuss, but if you have any statements or announcements, this is the time to do that. The next regular Commissioners Court meeting is set for Monday, February 8th. Commissioner Perez.
Yes, sir. I'd like to see if the rest of the commissioners have been getting their safety meetings, and nobody showed up for the last 5 months.
Your second one.
For the last 5 months, we've had nobody show up on safety meetings. Have y'all been getting yours done?
Nope. I should have one tomorrow, and I haven't been contacted.
Just a comment, can't do it.
Go ahead. Let's put it on the next agenda and ask Mr. Garcia to discuss it.
Good.
And just for the record, we need to point out that there's an open, unused pay slot in emergency management, and Mr. Garcia has asked to fill it, and I continue to hold him off. And it gets to be problematic with all the meetings and all the things that are going on. But let's talk to him about it and see how he feels, and maybe he'd start putting some, maybe not monthly, but maybe he can get started back doing something.
Or at least notify us if we're having the guys wait, and then.
Oh, well, that's not good. Yeah, sure.
Yep.
We'll put it on the next agenda, and we'll just have a discussion with him about it. I think that'd be the best place to do it.
Okay.
I have another request.
Yes, sir.
Future request for agenda item. We briefly had a conversation about how the other commissioners feel, but regarding driveways, if a developer is going to make a development and sell lots, my opinion is that's a commercial operation, and those driveways should meet our ordinances. Right now, they're not doing that. I mean, this is nothing we can take action on, but I think we should have an agenda item to discuss with the county attorney how we can handle this.
For subdivisions that open onto a county road.
Well, yeah, we're gonna take responsibility for the roads. The roads, they get our approval, but then the driveways are left to the residences. And they're not subject to any specifications.
Inspected or approved by
Yeah,
anybody.
they don't even get inspected.
Well, we can do that. We left residential driveway out of our driveway ordinance, but it's a simple thing to add it to them. Other counties have it,
Well, my point is, the whole theory behind this is, we have specifications for commercial operations, and a subdivision who's selling lots for profit is a commercial operation.
and we left residential alone because a lot of these are farms and ranches and large pieces of property. But I think we could add a narrow definition for subdivision approval into our driveway ordinance.
Okay, I'd like to get that on the next agenda.
I think it'd be very legal, and I think it's something to look at when it's a county road.
That's something we'd probably like to.
Sorry, I can't hear you.
That's something we'd like to be a part of as well. Maybe
Sure.
that's in that discussion
Be happy to have all the,
I would think we could overwhelm Rex with some of these 1,500 lot subdivisions that every homeowner comes in and hits me with. Maybe, some of our developers like to build these driveways when they build the subdivision and not refer to the homeowners. So maybe we can come up with a residential type standard, something that puts a little consistency to it, but yeah, I don't think you wanna go full-fledged concrete driveways.
No.
Like a commercial, because then it's not beneficial for your developer, but it should standardize in some way.
Yeah, this is the point, this is.
Keep us with some standard. Keep us kind of in the loop, and we'd be happy to help put some suggestions in that.
Okay.
And these driveways, also, water control, your culverts.
yeah, see,
I get hit by that after a subdivision. There's no culvert in these drives right now.
yeah, turning radius, water, drainage control, and line of sight safety. Those are all key things that we could add to it.
Yeah, I agree that we don't need to come up with a full-blown concrete driveway unless that somebody wants that, but these questions that were just brought up, yes, I think we need to address them.
All right, is there anything else? Do you have anything, Commissioner Gillespie?
No, sir, I'm good.
All right, well then our meeting is adjourned, and I already announced when our next meeting was, and thank everybody for your help having a good meeting today.